The Philippines logged more than 30,000 new COVID-19 infections weeks after a local case of Omicron variant was detected. To address the rising number of cases, President Rodrigo Duterte ordered local officials to limit the movement of unvaccinated persons and allowed authorities to arrest those who will refuse to cooperate. Officials claimed the president's order was meant to protect public health and to prevent the further spread of the virus. They noted that vaccines have been proven to be effective in preventing hospitalization and COVID-related deaths. However, some claim the policy violates human rights and discriminates against those who refuse to get vaccinated. With this, The Flame asks, should the government restrict the movement of persons who are not yet inoculated against COVID-19? How can the government strike a balance between containing the pandemic and respecting the rights of those who refuse to get jabbed for one reason or another?
I'm Dr. Josh San Pedro. I'm a community physician and the convener of the Coalition for People's Right to Health.
My name is Michael David C. I work as a medical doctor, emergency room physician on occasion, and also a part-time author. I wrote a book regarding the Philippine pandemic response from 2020 to 2021. I work here in Davao City.
This is Constantino Bautista, and I'm a former office employee, and now I'm just running my own store.
My name is Hilario Perez Jr. Nagtatrabaho ako sa Transport Cooperative ng Kalumpit, Hagonoy, May Kawayan Co-op. Ang posisyon ko doon ay Vice Chairman.
Basically, the idea of restricting people from movement is to actually protect those who cannot be immunized and who also have some, for example, comorbidities or problems with their own constitutions. But I do think that the way they do it with respect to the no vax, no ride policy it's really anti-poor.
Limiting access of unvaccinated individuals to essential goods, essential services, and even their movement infringes on their human rights. So this is something that has to be considered, especially with the reality that vaccines continue to be inequitable and actually even inaccessible to many in our population.
Kung ako tatanungin, hindi dapat Dahil kasi sila rin naman na nagkukulang, hindi naman nila kaya suportahan ng buong tao na masaksakan Paano naman yung mga hindi masasaksakan? Kung lilimitahan nila sa mga kailangan vaccinated ka para makasakay ka sa mga jeep, lalo na sa mga bus at jeep. Halos kasi dati kumikita kami sa isa round trip, kumikita kami ng 1.5. Ngayon minsan may time kami may 500 lang. Di ba napakalaki ng difference? Hindi kamukha nung lumalabas ang no vaccine ay sasakay namin. Kumikita kami ng maganda. Dahil kasi pagka kami nagsakay ng hindi vaccinated, walang ID, huli kami. Titikita ng mga driver namin.
The government should not restrict the movement of inoculated. Bakit mo i-restrict ang movement ng mga unvaccinated person? Ano ang legal basis mo? Hindi ba meron nga silang pinasambas? Republic Act 11525, which was signed no less than by the President, Rodrigo Duterte. Ano ang sabi niya sa batas na yan? Na yung vaccination card should not be made as a mandatory requirement for employment, for educational, or for other government transaction. Pero ano ginagawa ng gobyerno? Ginikipit niya yung mga tao. Kagaya nung nangyayari ngayon sa atin, no vaccination card, no ride policy. Simple. Pero lahat naapektuhan dahil lahat gumagamit ng public transport. Ngayon, ang tao, kahit ayaw magpabakuna, napipilitan silang magpabakuna. Bakit? Tinanggal mo sa kanila yung pinaka-primary na pangangailangan nila, kabuhayan. Pag ni-restrict mo, pinagbawalan mo yung unvaccinated person na sumakay ng public transport kagaya ng jeep, bus, MRT, para mo na rin silang tinanggalan ng kabuhayan. And worse, may ibang mga municipality na nagpapatupad ng no vaccine card, no entry kahit sa kanilang mga palengke. Kung tutuusin ng palengke, primary needs ang tawag nandiyan, food essential, na dapat i-exempted sa pulisiyang ito. Ang no vaccine, no card policy na yan is anti-poor. Bakit ko sinabing anti-poor? Sino ba yung pangunahing naapektuhan ng no vaccination, no ride policy nila? Hindi ba yung mga masang Pilipino na wala namang kakayahang bumili ng sarili nilang sasakyan? Pang-apat, it is discriminatory in nature. Ang bawat tao may kanya-kanyang rason kung bakit ayaw silang magpapakuna. Health reason or whatever reason, the government need to scrap or at least stop or reconsider implementing the no vaccine, no ride policy.
So first, we have to look into, again, the reasons why people are refusing, or even skeptical about the vaccine. So we have to go back to how effective are information campaigns. Is it really reaching people in the communities? Is it really reaching those individuals who still, up to this day, lack proper information on vaccines, on vaccination, and even about COVID-19? So
dapat gawin ng gobyerno, higpitan or at least ipatupad yung mga safety health protocols na yan. Hindi lang naman bakuna, pagbabakuna, yung tanging paraan para maiwasan ang virus. Maraming pamamaraan na pwedeng gawin ng gobyerno. Bakit kailangan itunin yung ilang lakas sa mga taong ayaw mabakunahan na bigyan ng bakuna? The government needs to respect. Kung ayaw ng mga taong magpabakuna, yun lang siguro ang dapat ibigay ng gobyerno. Respect. Every person can decide from himself kung ano yung maganda para sa kanyang katawan. Walang ibang nakakakilala sa katawan ng tao, kundi yung mismong may katawan.
Kahit no vaccine, pwede naman isakay eh. Basta mag-kuha siya sa protection. Di balik natin yung ginawa nila dati na naka-face mask, naka-face shield. Dahil kasi nung kung natatandaan nyo nung nakakaraang unang natin lockdown, di ba? Mayroong naka-face shield. Pero no vaccine, pagka no vaccine ka, pwede ka pa rin sumakay basta naka-face shield ka. Tsaka naka-face mask. Ibalik na lang nila yon para hindi rin naman nakukuha yung mga human rights ng ibang tao.
Admitting that because COVID-19 is airborne, that there should be an institutional shift. Instead of placing the onus or placing the burden of responsibility on the individual itself, this is apotheosized, or this is exemplified properly by the use of face shields. Instead of that they could create institutional changes like promote ventilation or actually donate or give away face masks, as what US has been doing right now. Give away better masks instead of giving away cloth masks. Perhaps with every jeep ride, or at least surgical masks, or better yet, KF94, KF95 masks can be distributed. But this is marred, or the foundation of this is, of course, an understanding and an understanding that COVID-19 is airborne, that institutional changes need to happen, and that there must also be a good information drive. A better alternative, now that I've actually formed it better in my mind, is, for instance, if the person is truly unvaccinated, provide N95 masks for these people. Provide better KF94s. Increase the budget of the health department in order to actually address these issues, rather than again place the burden on these poor people who might be unvaccinated because they could lose a day of work that's unpaid. And from these people who have a hand-to-mouth existence, this is such a struggle, especially because a lot of Filipinos are under the poverty line. But these pro-Christian, these draconian measures reflect the incompetence, reflect the lack of sensitivity of the current administration with respect to the plight of the Filipinos. Because they would rather save face rather than admit or address the institutional nature, or the more global importance of institutional changes, institutional implementations to address COVID-19.